Today we're going to take you through a course in Medicare 101 with Dr. Brent Wallis from People's Health to discuss the ins and outs of Medicare. Good morning, Dr. B. How you doing?
Hey, Tommy. I'm doing great. How about you?
Okay. We'll go with that. Yes, sir. What is Medicare?
So Medicare is a federal health insurance program. It actually started way back in 1965, and it was originally designed for people that are ages 65 and older. But actually in 1972, it was expanded to also include people with certain disabilities. And those people have to be deemed disabled for 24 months or longer to qualify for Medicare. And then the last group that is eligible for Medicare is people with end-stage renal disease. That's the last stage of kidney disease. And the funding for Medicare comes from the employment taxes that we all pay.
So what are the different parts of Medicare?
Sure. So these are the A, B, C's, and D's. So Part A, as we've discussed before, covers inpatient hospital. So anything that happens in the facilities is covered under Part A. And then Part B covers everything outside of the hospitals. So that's things like going to see your doctor, preventative screenings, and things like that. And then Part C is Medicare Advantage plans. So those are plans offered by private companies that actually administer that Medicare benefit. And then the last type is Part D, which D is for drugs. So that's your prescription drug covered as well.
So what is original Medicare?
So original Medicare only includes Parts A and B. So if you and your spouse paid taxes while you were working, then you're not going to have a monthly premium for Part A. You'll automatically get that. But Part B is going to have a monthly premium that you have to pay, and that's going to be based on your income in the years prior to taking Medicare. So what happens is once you're
Dr. B?
And it'll come in the mail. And
hey, Doc, I hate to tell you, but you broke up there for a little bit. I know it's important stuff. So
okay, I'm sorry. Can you hear me okay?
We can hear you now, but it just cut out completely. So let's go back to what is original Medicare, maybe start there.
Yeah, sure. So original Medicare is Parts A and B, and that's the part that you pay for in your taxes when you're working. So Part A you actually get automatically, but Part B you have to pay a premium, and that premium is going to be a monthly fee based on your income. So what will happen is you'll actually get something called a red, white, and blue card in the mail when you become eligible for Medicare. If you keep the card, you automatically are accepting Medicare. But if you return it, then you're actually refusing or deferring your Part B. And you can do that because sometimes someone will qualify for Medicare, but they may still be working, so they don't want to go on the Part B right away. And the card has all the instructions on how to use it when you receive it in the mail.
Wow. That seems extraordinarily complicated. Is it as complicated as it seems?
It's not as bad as it seems, but you do have to really be aware of what's going on, and a lot of people don't take the time to learn. So they get something in the mail, they don't realize what they need to do with it. So that's why this talk is so important and really understanding how it works.
Now, let me take an early break here. When we come back, we'll talk about after you accept Medicare Parts A and B, what happens next. 8:19, a lot of traffic trouble. Let's take a look at it now on WWL. 823, Tommy Tucker, WWL, talking to our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health about Medicare. I'm not close, but I got to tell you, I hope they simplify it somehow, Doc, when it's my turn, because I'm trying to follow you here, and I don't know, you're doing a great job. It's just the program itself. After accepting Medicare Parts A and B, what do you do next?
Sure. So keep in mind, original Medicare, so Parts A and B, doesn't include drug coverage automatically. So you have to choose a Part D plan to cover your prescription drugs. And actually, if you don't choose one, you might be subject to a penalty if you decide to enroll in one later in life. So you can choose a lot of standalone Part D plans, or you can choose a Medicare Advantage plan, and those usually include Part D coverage.
So besides drugs, what else does Medicare not cover?
So Medicare really only covers things that they consider medically necessary, and they make that decision of what they consider medically necessary. So some of the things they don't cover are things like alternative medicine, something like acupuncture is not covered, any sort of experimental procedures or cosmetic surgery, and then they don't cover dental or vision services at this time. So the other thing to keep in mind is Medicare only works in the United States. And so if you're going somewhere internationally, if you're getting on a cruise ship or something, make sure you look at the travel insurance because your Medicare plan's not going to cover you there. Some Medicare Advantage plans do cover those services, so you want to really look into it.
Wow, that's an important consideration because a lot of people travel. Is there any other coverage you can have in addition to Medicare?
Yeah, you if you've got an employer.
All right, Dr. B's phone broke up a little bit, and I guess he's going to be back here in a second.
Did I break up again, Tommy?
A little bit, yeah. So, but luckily you broke up right after I asked you the question. So,
okay,
is there any other coverage?
Good.
That's all right. Is there any other coverage you can have in addition to Medicare?
Yeah, you could have a group health plan with an employer. You could also have VA insurance. So if you're eligible for the VA, you do have to choose between either Medicare or that VA insurance because they don't work together. And then the last type is something called TRICARE for Life. So that's for active duty or retired military people and their families. And you have to have Parts A and B to be eligible for TRICARE for Life.
So what about enrollment periods as it relates to Medicare?
So there's 3 different enrollment periods. The first we always talk about is around your birthday. So it's the 3 months before, the month of your birthday, and then 3 months after. So when you turn 65, you've got a 7-month window to sign up for Medicare. And then the next is what we're in right now, which is the annual enrollment period. That goes from October 15th to December 7th. And during that period, you can sign up for a Medicare Advantage plan, you can go back to original Medicare, or you can change your plan. And then the last one is something called a special enrollment period. That's if you lose your coverage or if you move to a new state, you may have to choose a new health plan as well.
So how do people find out more about Medicare and Medicare Advantage plans?
So the best place to go is Medicare's website. So that's medicare.gov. And there's a whole lot of information like what I've described today about Medicare cover services, but you can also compare plans in your area. There's something called a plan finder where you can put in your zip code, the medicines you're taking, and it'll actually list all of the plans that are available in your area with the cost that you're going to pay out of pocket and monthly. So it's a really great tool to use.
And if people want to learn more specifically about people's health plans, which I'll point out is a 5-star plan, and that's not easy to earn, that 5-star rating, is it?
Yeah, no, it's very difficult, and we're super excited. You know, for the last 4 years, we've been a 4.5-star plan, and for 22, we are now a 5-star plan. So we're super excited that we've got that recognition for all of the work we do and all of the work that our members do as well. So, you know, really one of the best ways to find out about our plans, we have a great new service center. It's the People's Health Medicare Center. It's located right in Metairie, so if you're in the greater New Orleans area, it's at the intersection of Veterans and Causeway next to Party City. And during the open enrollment that's going on right now, we're actually having a mix of virtual and in-person presentations that can really teach you about Medicare and Medicare Advantage plans. And you can call us and actually make an appointment to come in and see us. We're being very safe. We're using social distancing, and masks are obviously required. But you can set up a one-on-one meeting or even come to a group presentation to learn a little bit more.
And how do people find out? Like, I guess there's a site they can go to see a list of when the availabilities are and so forth?
Our meetings are listed online, so you can go to
As Dr. B's phone breaks up again. Doc, I hate to tell you this, but you're really going to have to pay the bill, because what happens is they're going to keep doing this until they get that payment. I'm just kidding. No. But the in-person events.
My phone provider. I apologize for
that's
this
right.
morning.
I'm just kidding. Tell me about the website. Where do they go to find out about the availabilities? Well, I'll tell you that. It's peopleshealth.com/meetings, or you can give them a call and they can find one near you. The number is 1-844-600-7910, and to find out more about People's Health. And they are a 5-star rated plan, and that is some very rarefied air. You can call 1-800-978-9765. Go to peopleshealth.com. Follow People's Health on Facebook, Twitter, and Instagram. Tim, is Dr. B still there so I can tell him goodbye? Doc, you there?
I am, if you can hear me.
I can now. Thank you, sir. Have a great weekend, all right?
Thanks, you too.